We'll talk about why people might fall for fake cures. Is Peter Kinderman from Liverpool. He's with the professor of clinical psychology at the University of Liverpool. Thanks so much for being with us. We appreciate it. You know, many of us really laughed when we heard about President Trump, for example, talk about using bleach to cure COVID-19. We laugh because, who would listen to that? Who would actually think about taking bleach to try and treat this disease? Yet we're finding out, people actually do. Why would anyone turn, to such an obviously dangerous method to prevent a disease that likely wouldn't even kill them just to find something?
Okay, so the first thing to say, I think, is that most people don't fall for these scams. The vast majority of people in every country are being extremely sensible. They're taking precautions about their health. They're following the official advice. They're using face masks. They're washing their hands frequently. They're keeping their distance from other people. They're cooperating with the track and trace systems. They're following the official advice. The second thing to say is that even in your package there, where there were politicians as well as quack doctors promoting these sorts of fake cures, these were against the advice of health advisors. And indeed, even with President Trump was talking total nonsense about bleach, but his most senior public health advisors were clearly disagreeing with him, which is why, of course, they fell out of favor with the man in power. So the first thing to say is that most people are not giving this advice. Most people aren't falling for it. Then why do people fall for fake cures? I guess because people want to have an answer, because people would like to have something simple and, I guess, conventional in the sense of taking some medication that would mean that they would be safe. Being at risk from COVID-19 is a fear we all have. So if you feel that you can achieve something that would give you an advantage, that's a good thing to go for. And I think part of the problem is that our news media is very disseminated these days, so it's difficult to know what an authoritative source of conventional, good, true medical information is. And the other thing is that we can see right-wing politicians especially exploiting this crisis for their own benefit. So if you are seen as a leader, like, for instance, Donald Trump or some of the other right-wing leaders who, by virtue of their charisma, can offer something special to their citizens, maybe they think they're going to get an advantage. So you've got bad leadership by politicians, you've got the natural desire for people to find a cure, you've got confusion about what the truth is, and then you've got people exploiting the situation for their own benefits. But again, 80–90% of people don't fall for this nonsense.
Okay, Peter Kinderman joining us there. Thanks so much for your insight. We appreciate it.